Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. This program is supported by San Juan Health Partners Urology, providing a wide range of personalized services for the whole family, including children. Our caring professionals are dedicated to helping meet your urology health needs with skill, experience, and service you need. For a complete listing of our services and to learn more, visit sanjuanhealthpartners.com or call 505-609-6300. San Juan Health Partners Urology, a division of San Juan Regional Medical Center. Radio studio, Dr. Bob Underwood is here. He is the Chief Medical Officer at San Juan Regional Medical Center. Dr. Underwood, good morning.
Good morning.
Thank you for being here.
Thanks.
Appreciate you coming in to talk a little bit more about the job that you do. We were talking before we came on the air this morning. It's been almost a year.
Almost, yes.
Right?
Yep.
December of last year.
December of last year is when I started. That's correct.
And talk to me a little bit about what you do. What is the job of the Chief Medical Officer, different from Chief of Staff?
That's correct. So I'm the Chief Medical Officer of the hospital, which means I'm one of the senior leadership team of the hospital. I do not practice medicine at the hospital. I'm more of an administrative role, overseeing the medical care that's provided at San Juan Regional Medical Center.
I see. And so you are juggling, watching all the different other medical professionals who were at the hospital, right?
That's correct, all of the above.
And how big a number is that for folks who aren't familiar? What are we talking about?
So actively, we have probably 175 or so medical staff members. We have quite a few more physicians in our community, but those are the people that are actively working at the hospital on any given day.
Gotcha. They have the privileges, or is that the term?
Correct. They have privileges to practice at the hospital, and they actively see patients at the hospital. We have a number of people who are in the community who are community affiliate, so they have credentials at the hospital, but they don't actively see patients. And then we have some that actually have active privileges, but don't admit very often.
I see.
So when I say 175, that's kind of people who are coming in, admitting patients, and are regularly part of the healthcare at the hospital. And that's everything you can think of: emergency physicians, radiologists, hospitalists, anesthesiologists, and a number of different surgical specialties.
Gotcha. That's a lot to keep track of, it sounds to me.
It is a lot to keep track of, that's true.
Yeah. And so you've been here about a year. You came to us from Colorado.
Pueblo, Colorado, where I was the Chief Medical Officer in the Centura system.
Gotcha. Yeah. Well, and you're enjoying it so far, you were telling me.
Love it.
Good.
Yep. I love it here in San Juan County and in the Farmington area. It's been very welcoming. The people have been incredibly great.
That's great
to work with. So.
Good to hear. Well, I'm glad that you're with us this morning, because there's a lot, I think, about the medical care these days that confuses a lot of people, me included. And maybe you included, I don't know.
Me included, yes.
But there's a lot, and it seems to be kind of a moving target, a changing environment when we talk about maybe legislation, Affordable Care Act, insurance,
correct,
co-pays, and all.
Yep, absolutely. And I have to say that since I've been in healthcare, people have said I've never seen it change at a pace this fast. And I've been doing this for more than 20 years now, and it just seems to be speeding up.
Right. Good thing, bad thing?
Both.
Okay.
And it kind of depends on your perspective.
Gotcha.
Of course, change is difficult for people, especially people who have been doing the same thing for a long time. However, change is good because we always want to progress. And to be honest with you, healthcare wasn't always required to be as frugal as they've had to be in the more recent years. They've not had to watch money, and that's one of the reasons why healthcare costs in the U.S. have escalated. And that's, down to the individual, but if you look at the national statistics, the cost of healthcare in the United States is going up faster than our gross domestic product, and that's unsustainable.
Right.
And so when we talk about regulations, as you brought up in the Affordable Care Act, a lot of that is driven towards how do we slow down the pace of that growth so that we can get it into a controllable level. It's quite an undertaking because it's so new, and that gets to how we have to change the way we manage healthcare. It has to do with how we finance healthcare. It has to do with the advancement of technology. Like you said, 100 moving parts or more to try to keep track of.
Right. And it seems to me like when we're talking about the patient, the insurance company, and the hospital and the doctors, and some groups are caught in the middle.
That's correct.
It seems a little bit about that tug of war, if you can describe it that way.
I think that you can. If you look at it in terms of healthcare management or graduate level education, they call it cost shifting. So one person ends up with the burden of the cost until they shift it to somebody else, and it kind of moves its way around from the payer to the provider to the patient. And somewhere in between, sometimes we're caught as to who's paying the burden of that.
Right.
So.
And at San Juan Regional Medical Center, it's somewhat unique in that it's a not-for-profit hospital, and there are other communities that have more for-profit medical facilities, and so that's a unique thing too, is it not?
I wouldn't say it's completely unique. A lot of healthcare organizations are religious or not-for-profit based.
Sure.
And then there are a number out there, and I think that number is actually growing in terms of for-profit organizations. So what is unique about San Juan Regional Medical Center, and one of the things that attracted me here, is that A, it's not for profit, B, we are a standalone community facility. In other words, we're not part of a larger system. We are a community hospital that serves just this region. The other is that we are actually owned by the public, which I think leaves us very, very tied in a good way to our community. And those are all things that attracted me to this organization. The other is because we are a standalone facility tied to this community, is we set our direction. It's not a corporate entity that decides what San Juan Regional Medical Center is going to be doing. Rather, it is us determining that and trying to figure out what is best within our capabilities to serve our community.
Right, and it's the makeup of that corporate board of directors too that's very unique. I think very interesting, at least to me. I mean, it's a large number of people that come right from the community.
That's correct, and we meet quarterly, and I usually am one of the folks that will address the community in terms of what is our staffing of physicians who are recruiting into our area, in terms of what specialties, et cetera. So,
right.
Yeah.
And when we talk about healthcare these days, it seems like maybe folks remember their parents or grandparents talking about just going to the doctor, make me feel better. I don't feel well. Just, give me a pill or whatever it takes and
Right.
send me home or admit me and whatever. These days, it seems like doctors expect maybe patients to take a little more responsibility for their own health. We're trying more preventative care, at least trying to get patients to be a little bit more involved in their own health and that of their family. Is that?
Absolutely. I think that if we look at healthcare as a whole, there's always a lot of comparison to other countries.
Right.
But that is something that is actually a little bit more well defined in other countries, is that personally responsible for your own health care. So we talk a lot about wellness. We talk a lot about preventative care. We talk a lot also about chronic disease management. The population is getting older, and there are chronic diseases that are out there that, if not well managed, can end up with a hospitalization. And so we actually try to avoid that. We try to avoid our patients coming to the hospital by managing their disease process proactively as best as we can.
Sure. And is that, it seems like it's a good thing to have the patient more involved in their own care, their family's care, things like that, and maybe trying to prevent some of these things by eating healthy and moving more and staying active, things like that.
Correct. And also taking the medications as they're prescribed on a
Sure.
regular basis, making sure you're getting your follow-up care. Absolutely, it is good, and good for the health of the community as a whole.
Right. And the hospital, it seems to me, San Juan Regional Medical Center specifically, has been very involved in doing preventative things or promoting preventative things, some of the walks, some of the activities and the equipment and things that have been installed in some of the parks to get people active and remind us that we need to stay active and things like that.
Absolutely. I think that San Juan Regional does a great job of doing that and definitely promotes things. In fact, the Walkathon for Cancer is coming up in the very
Saturday.
near future, and
Yes.
we are sponsoring that.
Of course.
So Yeah, you bet. I think that all of those things are good. Designed, what we call design communities that are kind of designed around being active is something we'd be interested in the future as well.
Right.
So,
and when you're talking to the doctors and the folks that work in your field and managing them, I mean, they seem to be on board with this new trend, and I don't know if it's really new anymore. It's been there for 20 years, but
Correct.
this trend in healthcare of educating the patient and trying to make them more in charge of their outcomes.
I think that certainly, so physicians are on two sides of that, and both in the same direction.
Right.
What I mean is, yes, they want what's best for their patients, and that gives them the best patient outcome. But the other thing that is always looked at, and more so now than it has ever been before, is what are the individual physician outcomes. And those things are published by various bodies. They want good quality outcomes for their patients because it reflects on them as a provider. And they know that these types of activities will be good for them, whether that's orthopedics, getting people out and exercising post-operatively as quickly as possible, getting people up and moving, all the way to internal medicine, where you may be trying to manage blood pressure, diabetes, or heart disease. All of those things come with the preventive side of it.
My guest this morning, Dr. Bob Underwood, is here. He is the Chief Medical Officer at San Juan Regional Medical Center. We are talking about the world of medicine these days, and hospitalization and treatment and all those things. And you're dealing with the medical staff at the hospital, about 175 folks
Or so, yes.
More or less, Steve.
Yep. And people come and go, physicians come and go all the time.
Of
So,
course.
yeah.
That's very true. But talking a little bit about that, it seems like, again, and you mentioned it too, trying to get folks up and out and moving again after a procedure, after surgery.
Sure.
Back in the old days, you might stay in the hospital for 7 days, and that's unheard of these days for most things. I mean, there's still some people that are very sick that need to be there, but a lot of times it's that nurse or that doctor wanting us to get up and just start moving to start that healing process.
Absolutely, and that is a change over the last several years. Is the sooner you can get somebody up and moving, the better it is for them, better for the surgery. Used to be that you came in and had a baby, you were there for days. It's kind of a next day discharge these days. Gallbladder surgery, 5-day admission, no longer the case.
No, right.
Some of them are even done on an outpatient basis now.
Wow.
It's very, very interesting how we've seen the trends. And the thing is that it was perhaps just an urban legend that you needed that rest. What we found is the science proves that the sooner you're up and moving, the better it is for the patient.
Right.
So it's kind of an interesting shift overall.
Yeah. Well, and as homely as you try to make the hospital rooms appear, it's, I guess, being at home is certainly better for the patient in most cases.
Absolutely. The sooner you can get back into your normal environment, the better it is for the patient, generally speaking. Also, there's a lot of things that are happening at a hospital. It's not a place to rest. There's always activity going on. You're going to do better in your own home. Additionally, there's a lot of sick people in a hospital, and the sooner you can be in your normal, healthy environment, the better.
Right. And that's all part of these conversations and these decisions, I suppose, to get patients in and out, right?
Yeah, absolutely. That's part of it. We work really hard on, and these are things that we talked a little bit about the government, things that the government tracks. They look at how long do your patients stay in the hospital? What are their, if they get readmitted within 30 days, usually that's a hit on the hospital.
I see.
And so we try to look at how do we keep patients once they're discharged, how do we make sure that they're home, healthy, and stable enough to stay home without having to be readmitted. We look at what we call hospital-acquired conditions, which include infections. There's different kinds of infections that we look at and we track very, very carefully. A number of other things that we keep on what we call our harm scale, patients who fall in the hospital, patients who end up with infections, patients who can have surgical complications. All of those things are tracked very, very carefully, way more than they ever used to be. Those things are reported through the government. The government keeps track of them. A good way to avoid all of those things happening to a patient in the hospital is to have them at home rather than in the hospital.
Right. And that's what we see.
Yes.
In most cases.
Absolutely.
I mean, for sure.
Yep.
Is cost part of that too? I mean, I'm sure it's cheaper for me to be sleeping at home than sleeping in your bed.
Absolutely.
At the hospital.
We are the most expensive hotel in this community. No, absolutely, and that's something that we look at. It's not just us either in terms of length of stay. That's how we term that, readmissions, et cetera. Absolutely, trying to reduce the overall cost of healthcare. And again, this is not San Juan Regional necessarily. It is every hospital system in the country is being scrutinized for those very points that I just talked about.
And these statistics that you keep mentioning that are being reported to the government, these are available to the public, I would think, right? In certain reports or what have you. And as the public becomes more involved in their own healthcare, I mean, they are, I guess, encouraged or could be encouraged to review, compare, contrast different healthcare providers and hospitals and things like that?
Absolutely. So the CMS, which is the Centers for Medicare and Medicaid, they actually have public reported information that you can look up. One of them is called Hospital Compare, where there's a star rating. There's a lot of deliberation of the validity of the data that goes behind that, and the American Hospital Association debated it a lot. But the star rating is there, and it's publicly available. I have to say that when I came here, it's a 5-star rating scale.
Right.
When I came here, we had just moved from a 2 to a 3-star rating, and we are waiting for the final to come out. They were supposed to have reported, CMS was supposed to have reported a couple of months ago, but we've got unofficial word that we're moving from a 3 to a 4-star. As a hospital within the community. And that's great for our community.
Very good. Well, and that's within 12 months, it sounds like, right?
Absolutely.
So that's quick work.
Now, yes and no. It's lagging data. It's the Centers
see.
for Medicare and Medicaid, and they have a 2-year period of time that they review. That 2-year period of time ended about a year ago.
I see.
And we are intending that will trend in the same direction. We'll move to a 5-star.
I think you should still take some credit, though.
I will take credit where I can.
Okay, fair enough. Dr. Bob Underwood is my guest this morning. We're going to take a short break, Dr. Underwood. When we come back, more with my guest in just a moment here on KSJE. It's Wednesday morning on KSJE, and you're listening to the Scott Micklin Morning Program. Good morning, everybody, listening at 90.9 FM, and greetings to our viewers who are watching on the KSJE Facebook page and YouTube channel as we stream our program out onto the internet from our visual radio studio here at San Juan College. I'm Scott Micklin. I'm joined in the studio by my guest this morning. Dr. Bob Underwood is here. He is the Chief Medical Officer for San Juan Regional Medical Center here in Farmington. Again, Dr. Underwood, thanks for being here.
You bet. Thanks for having me, Scott.
It's good to have you here to answer some of these questions for us about the changing world of medical care, and it seems like every day there's a new story in the news about some new proposed legislation or some new differences in what's going on in Europe and what's going on over here, and
Sure.
why can't we do what Canada does or what have you. So it's an ongoing and evolving conversation.
Yeah, it's constantly ongoing. The government, there's a lot of pushback, I think, from healthcare from what the government is trying to do. But if you look at their motivations, I think that the motivations are appropriate, and that is to reduce the overall cost of healthcare. Healthcare has what they call the triple aim. And in the triple aim, we're trying to improve the experience of healthcare for an individual, improve outcomes, and decrease the overall cost. And so if you really look at that, that's a value proposition, value typically being quality. And so if we can reduce cost and keep quality the same, then value goes up. If we can improve quality and keep costs the same, value goes up. But overall, it's really driven around the value of healthcare.
Interesting. And so, but a lot of folks will say we have very expensive healthcare in this country compared to maybe other countries. Is that just because of the system that we're working within?
Part of it, of course, it's always multifactorial. Mm-hmm. Some of it is just the history of the way healthcare has evolved and the financial realm of healthcare, insurance companies, et cetera. Those are some differences. The other is there are multiple things that build into what you normally will see is the cost of healthcare balanced against what is our quality. And that quality component is the piece that is actually multifactorial. They look at healthcare and say, well, your outcomes aren't as good, but it's really expensive. But then you got to play in genetics, education, finance. All of these things play into healthy lifestyles, healthy lifestyle choices of patients. Those are factored in some of the other countries that we look at, and they have a more active or proactive approach to some of those areas, more so than the United States may. When we look at our cost of healthcare, we're just talking about the cost of medical care. We're trying to, I think in the U.S., move farther away from medical, more towards health. And a lot of that is preventive, as we spoke in the previous segment.
Right, exactly right. And I guess the other question would be, in other countries, is the quality that consistent for everybody, or is it quality for those who can afford it and not so much for those who cannot, even if everybody's covered in some capacity?
Yeah, that's correct, and it depends on how you look at it. Generally speaking, if I were to have an emergency medical condition, I would not want to be anywhere other than the United States.
Any other country?
Any other country. I would much rather be in the United States. When I was in grad school, we looked at the Japanese, the German, the British, and the Canadian system side by side with the U.S. system. And overall, I wouldn't want to be anywhere else. Again, I said if I had an emergency condition, there's just no place better to be. But that's one of the things that is part of that evolution of our healthcare system, is that we're really good at rescue medicine, not so good at the chronic disease management, at the preventive stuff that we were talking about earlier.
Right.
Yes, other people in other countries can afford it. Different tax structure, different payer base. And so that is very much different than the United States in the way that our systems have developed over time, with private insurance, self-pay, Medicare, Medicaid, all playing into that cost mix,
right,
if you will.
And I don't want to make this into a political program, but I do want to ask you about the Affordable Care Act, because that is the first, I think, most major change to health care in generations.
Right.
And it has been looked at by government officials as maybe tweaking it, getting rid of it, putting something else in there, or what have you. But it's still there, and that is still the law of the land, and that's what the rules everyone's playing by at the moment.
Yeah.
Has it been a good thing as far as San Juan Regional Medical Center is concerned, to have this available to everyone? And it seems like folks are taking advantage of it, maybe more than they were. They couldn't afford care before, maybe now that they can, some families.
That's true. There were certain, especially with Medicaid expansion.
Which New Mexico is done.
Right. Same in Colorado, where I came from. I also worked in Virginia prior to that, and Virginia chose not to expand Medicaid. So that certainly provided a broader population base that could afford to come get health care. Some other things that happened is some employers said, well, you're qualified for Medicaid now, so they stopped providing private insurance for their employees. So there's been a mix in terms of how people have perceived it. Overall, initially for hospitals, it was a really good thing because there were patients that we were taking care of anyway who were not in any payer mix. They were self-pay, and that often meant that it was going out as charity care. But now they're in the payer mix, so we're at least getting some revenue, even though it's not enough to cover the care that's provided when it comes to Medicaid, generally speaking.
I see. More than you were getting before.
It's more than we were getting before, but now those Medicaid numbers have actually expanded too, which means we have more people that have moved off of private insurance, which was better for the hospital in terms of revenue, down to Medicaid. And so that's been it's been an interesting balance in trying to keep up with the revenue stream based on all of these changes, because they're happening so fast. It's been really interesting and fun to predict.
Interesting is a good word. Fun to predict. I don't know if everyone would agree with you.
Yeah, maybe not. There's reasons some of us chose to go into administration, and that's because we like this sort of thing.
Right. Well, there you are. Well, that's never a dull moment, I guess, is what we can say.
Absolutely never a dull moment. And, in the end, what we're really trying to do is provide the best care for the patients in our community.
Sure.
And so trying to predict how do we do that and still maintain the appropriate financial position for the organization so we can keep doing that, so we can continue to fulfill our mission as an organization. That's always been the fun balance.
Right. Well, and there have been some stories that I've seen in the media about maybe community hospitals or other hospitals in some more economically disadvantaged communities shutting their doors because of some of the changes. And I don't know the exact cause, but I can only assume it's because of some of the changes in this payer mix, and the profitability maybe just isn't there anymore like it once was. Is that reasonable?
I think that that's a reasonable statement, yes. It depends on the community.
Right.
But yeah, that's something that has definitely happened.
And that leaves those communities then without a hospital, or maybe they had a couple in their community and the other one can pick up the slack or whatever, but for others it may be a commute to get emergency care or medical care.
Yeah, that is absolutely true. It does depend on the community.
Yeah.
Some of these facilities are in larger cities, and yes, then there's alternatives. Unfortunately, I've also read about in a couple of journals some hospitals where they were the sole community provider, and that's really bad for that community.
Right. That's unfortunate to see.
It is.
In any event.
It is.
But our hospital is healthy.
We are.
And stable and is weathering whatever the uncertain seas are out there in the healthcare world. Would that be a fair analogy?
I would say that that's a fair analogy, and we're always trying to predict what's going to come next,
right.
Whether it's from the federal government, state government. So we're, especially Jeff, he's our CEO, he's very actively communicating with those forces to try to understand how it's going to position our facility as we go forward.
And we talked about things at the federal level, but there's also changes sometimes at the state level, too, that can complicate things, or just maybe, I'm not trying to remember, I think maybe a sales tax bill on nonprofit hospitals or something like that, if I'm remembering. Right?
Yeah, there's been discussion about that, and so
that would be a significant impact to your bottom line.
That
right?
would be a huge impact to our organization, and so we look at most not-for-profit organizations have some tax advantages, but there are certain parameters where you maintain your tax-free status, and we work very hard to make sure that we're doing those things for the community. And usually that's what it is. It's doing outreach for the community, providing community services that otherwise would be unmet if the hospital weren't doing them. And usually we do those without charging for those services.
Healthcare is often touted as a way, in healthcare services, a way for economic diversity for the community, and,
sure.
and something that people look towards San Juan Regional Medical Center to maybe provide some of that economic growth as we look to diversify the economy of Farmington and San Juan County. And it seems like the hospital has stepped up and continues to be a very active partner in some of these efforts, some of the improvements and increases in cardiology services and the other services that you and the hospital provides to the community.
Yeah, absolutely. We bring people in from outside. Obviously, physicians are the ones that typically stand out. You know, there's not a medical school here,
right?
So we have to bring our physicians in from other areas. There are several physicians who work in the community who were born and raised. They went away, they went to college, they went to med school, and they came back because they wanted to serve our community. And I think that's great. But we have a lot of physicians also who came from outside of this community, bringing those services in. And of course, that brings diversity. The other thing that is, of course, has a big impact is we recently did a little bit of a restructure around our information technology at the hospital, which is going to also bring in some employees from outside of our community to provide high-end technical support around our health care.
You're talking about switching over to another system, I guess, right? That will help maybe coordinate all of the information
Correct.
that the hospital generates about a patient, about a procedure?
Correct. And so we're moving. We actually currently, and this is unusual, so this is something that's bringing San Juan Regional Medical Center kind of into the modern age around healthcare IT. But we're moving from essentially 5 different platforms of information technology for patient care to a single platform. That's going to be a big benefit for the patients within our community. Overall, Cerner is the name of the company. Worldwide, they're actually the largest IT healthcare provider. In the United States, they're number 2, but they have platforms that have been rolled out all over Europe, et cetera.
Interesting.
Yeah.
I'm thinking about it, and I can only maybe describe it to our listeners and viewers this morning as maybe working on a Windows machine halfway through your project and then having to switch over and finish it on an Apple machine. But then it's 5 other computers part of that too.
That's an accurate statement because it's all software driven.
Right.
And so,
but a whole different way of entering data maybe, and other
different
things,
way that data is kept, and also the different ways that data is shared. One of the analogies I like to give is if I have a patient, for example, who's having an asthma attack, and they go in to see their regular physician, that's part of San Juan Health Partners,
right,
which are our employed physician group. Then they come in, they may get a dose of steroids and an albuterol inhaler, but they seem like they're getting better and they're sent home. But then later that night, they seem like they're getting worse, so they come to the emergency department. So now the patient's in the emergency department, they're on a different IT platform. And the IT platform in the emergency department doesn't talk to the one in the offices right now. So the physician in the emergency department can't necessarily see exactly what happened earlier in that day. Then, if they get worse still and end up having to be admitted to the hospital, they get admitted to the inpatient floor of the hospital, and that IT platform doesn't talk to the ER and doesn't talk to the office system. With what we're employing, that'll be one system, and all 3 of those visits will all show up together.
Interesting, because in that scenario, at least the patient is conscious and they can tell you what's been going on. But
Absolutely.
if someone comes in who isn't, then you're kind of guessing or stuck.
Well, you're kind of stuck. We have methodologies around that. I'm an emergency physician by training.
I see.
But yes, absolutely, we're at a significant disadvantage. And the other component of that is that we can find that information or find ways to do it, but it takes time.
Right.
And sometimes, especially in the emergency department, time is not exactly a luxury you have.
And with this new system, I guess that the information would be almost instantaneous, I guess, when the patient presents.
Correct. It would all be on a common platform. I can go to the patient's medication list, and all of that information will be immediately available to me in the ER.
Interesting. Anyone familiar with software probably knows this is not a cheap endeavor.
No. It is not at all.
And takes a while to implement. If you're talking about a major medical facility with 175 doctors and I don't know how many computer terminals in the building.
Yeah, hundreds of computer terminals, and of course every employee of the hospital has to be trained up on the new system. So, we're talking nurses, respiratory therapists, radiology techs, physical therapists. Everybody has to learn how this new system works. Registration in the waiting area of the hospital. All of those people have to be trained on this new system. And so it's across the board. And then physicians too, and physicians taking their valuable time to learn how to use the system because they know in the long run they've got to learn how to get a patient through that system and get the information in that's very, very valuable. The other thing that's going to be really great about this new system is it gives us the patient outcome data immediately at hand. Currently, like I said, if we have 3 different systems and we're trying to pull out what are our patient outcome data and how do we go about a systematic improvement of the way we provide care at the hospital, which is what every other industry does, and healthcare is new to the game in that. But having a good IT platform that helps us generate what are those outcome data, how do I look at how my patients fared, how much did it cost to do that, that's really where healthcare is starting to go, and that gets all the way back to the Affordable Care Act that we were talking about before, insurance payer groups, et cetera. Without a good information system, it's really hard to drive that improvement the way we need to do it.
Interesting. Just a couple minutes remaining this morning,
Sure.
Dr. Underwood, and I want to ask you a bit about when folks maybe get frustrated with medical care. Maybe not the hospital, maybe not their doctor, but maybe the insurance company or maybe something else, but they have this problem and they want to come and they can't get it taken care of until they get an okay from whoever's going to pay the bill, and
Right.
then they can go forward with that, or maybe there's a misunderstanding or who knows, but it's got to be frustrating all the way around for not just your physicians, but the patients too.
Yeah, absolutely. It is a navigation at best. And I have to say that I was recently a patient, and I had frustrations with trying to get pre-approval, and I know the system. And so if I know how these things generally work, I know how frustrated it is to somebody who's not part of that. So one of the things that that some insurance company have is a navigator to help you through that system.
Right.
Not all do, but that can be very, very beneficial. We have that in our hospital in some service lines, which is also beneficial. A joint replacement, which we talked about before,
Right.
for example, has a coordinator that'll help navigate somebody through that system.
That can be very helpful, I'm sure.
It can be very helpful. And there are some organizations that are working hard, not only for that navigator to help with the system around payment, but also health coaches that help patients understand when they're supposed to be taking their medications, making sure they make it to their follow-up appointments, et cetera. Some of the big organizations are doing that. We're talking about Cleveland Clinic, right. Mayo Clinic, et cetera, but they're on the cutting edge of how do we change this healthcare delivery model to make it more understandable, more feasible for the patients to understand really what's going on with their own healthcare.
Right. Final minutes this morning, and the new story of the new hospital that opened in Santa Fe. Folks were comparing it to a hotel more than a hospital. You mentioned that you have the most expensive rates for overnight stays in the,
right.
in the county.
Right.
But it seems like hospitals are turning more into nicer appearing buildings. San Juan Regional has won an award
sure.
for the appearance of its building, and all that is part of the healing process, to be surrounded by garden areas and a hospital room, that doesn't look like a hospital room. All that, I think, has been studied. It can be advantageous for a patient.
You bet it really is. And that was one of the things that appealed to me the first time I toured this hospital as well. There's balconies in some of the patient rooms. We have meditation rooms on all
right.
of the floors. Yes, they are very, very beneficial to the patient. Remember when I talked about the triple aim, that one of the points of the triangle in the triple aim is to improve the experience of care for the individual patient. And I think that that's all part of that. It gives the patient a sense of well-being as they're having to navigate what is often a difficult part of their life, to be part of the healthcare system. I'm part of a healthcare system by choice. Most patients aren't.
Right. Well, that's true.
Yeah.
But they certainly, I think, appreciate the time that they're at the hospital, or maybe in hindsight, they can appreciate the time that they were at the hospital if they really want to get home. But having those surroundings that are a bit more maybe beneficial is certainly part of the process.
Sure. That and the overall experience of care, we as other organizations across the country are really working to try to improve that as well. The patients' interaction with the staff members, with their physicians, with their nurses, with their respiratory therapists, with their physical therapists while they're in the hospital, to make that experience the best experience that it can be for the patients. And we're working hard to try to drive that improvement, and that's always a constant. We survey patients, we survey staff members, looking at where are opportunities for that improvement.
Very good. Dr. Underwood, we're out of time this morning, but I appreciate you being here.
You bet. It's been very enjoyable, Scott. Thank you.
Thank you for coming in. Dr. Bob Underwood, he is the Chief Medical Officer with San Juan Regional Medical Center here in Farmington, my guest on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.